Gray's profile. Gray is a 33-year-old African American female presenting with depressive symptoms, anxiety, and substance misuse. She is currently engaging in sneaking Xanax, highlighting a significant concern for her mental health and overall well-being. DSM-5 diagnosis. Gray's diagnosis include unspecified depressive disorder, F32-9, as primary, and other substance use disorder, mild Xanax, F19-10, a secondary. These diagnoses reflect the complexity of her mental health alongside her substance misuse. Here are some key points provided for Gray. The reasoning for Gray's diagnosis is based on her symptoms. The symptoms identified are depressed mood, anxiety, and behavioral inconsistencies. Substance use connection. The behavior inconsistencies are linked to substance use. These points highlight the importance of understanding the relationship between the symptoms and substance use, and the necessity for careful evaluation and targeted interventions. Rationale for diagnosis and diagnostic rule-outs. The rationale for Gray's diagnosis stems from her symptoms, which include a depressed mood, anxiety, and behavioral inconsistencies linked to substance use. These indicators entail careful assessment and intervention strategies. Key diagnostic rule-outs for Gray include major depressive disorder, generalized anxiety disorder, and alcohol use disorder in sustained remission. These considerations ensure an accurate diagnosis and important treatment. Some key points for rule-outs for Gray. The diagnosis is major depressive disorder, generalized anxiety disorder, alcohol use, and sustained remission. The purpose of rule-outs. These diagnoses need to be considered and ruled out to ensure accuracy in diagnosis. Accurate diagnosis. The rule-out are crucial for making accurate diagnosis. Appropriate treatment planning. An accurate diagnosis will guide the development of the appropriate treatment plan. These points emphasize the importance of considering the potential diagnosis to ensure proper diagnosis and treatment. Ethical, cultural considerations. Interventions for Gray must be culturally sensitive, tailored to her individual preferences. This involves respecting her autonomy and addressing any assumptions regarding her sexual orientation and other relationship dynamics. interventions that would fit Gray are cognitive behavioral therapy, CBT. CBT is a structured, goal-oriented therapeutic approach that focuses on modifying maladaptive thoughts and behaviors. It integrates cognitive restructuring and behavioral activation, making it highly effective for mood disorders and substance use. Some key points are structured and goal-oriented. CBT is a well-organized therapy with clear goals. It focuses on modifying maladaptive thoughts and behaviors. The primary aim of CBT is to change any negative or unhelpful thought patterns and behaviors. Integration of techniques. CBT combines cognitive restructuring, which is changing distorted thoughts, and behavior activation, which is encouraging positive behaviors. Effectiveness is particularly effective for treating mood disorders and substance misuse. These points highlight CBT's approach and its effectiveness in treating emotional and behavioral issues. Motivational interviewing. MI is a client-centered directive approach designed to enhance natural motivation for change. Through collaboration and empathy, MI addresses doubt and fosters a strong therapeutic alliance, making it suitable for the client in recovery. Some key points for MI is to focus on a client-centered collaborative approach that focuses on enhancing a person's motivation to change. It recognizes that people often have doubts about change, and MI aims to help individuals explore and resolve the doubts. Techniques involved in MI are open-ended questions, reflective listening, affirming the client's strengths, and summarizing the client's statements to help them discover their own reasons for change. The goal of MI is to primarily strengthen the person's motivation to make positive changes, often in areas like addiction, health behaviors, or lifestyle changes. The approach for MI is non-confrontational and empathetic, with the therapist acting as a guide who helps the client recognize their own desires and goals. The therapist does not tell the client what to do, but instead helps the client explore their values and reasons for change. Common uses for MI. MI is commonly used in the treatment of addiction as well as in health-related behaviors like smoking or weight management, and can also be used for clients who are doubtful about starting therapy. Some key differences for therapeutic focus. CBT focuses on changing negative thoughts, patterns, and behaviors to improve emotional well-being. MI focuses on resolving doubtful and increasing motivational for change in any unhealthy coping strategies or behaviors. Techniques and approach. CBT is a more structured and directed with specific exercises aimed at changing thoughts and behaviors. MI is more flexible and client-centered, focusing on guiding the client to explore their own reasons for change and what could trigger them. CBT is a wide range of psychological disorders. MI is particularly effective for clients who are resistant or doubtful about change, such as substance use in individuals. Recommended level of care. For Gray, outpatient counseling with periodic substance use evaluations is recommended. This level of care allows for ongoing support while encouraging independence and personal growth in managing her addiction and health symptoms. Some key points of recommended level of care. When recommending treatment, outpatient counseling with periodic substance use evaluations is recommended for Gray. For ongoing support, this approach provides continuous support while allowing Gray to manage her own treatment. While recommending level of care is also encouraging the independence in the treatment plan encourages Gray's autonomy and personal growth in handling her addiction and mental health symptoms, and knowing how to be aware of the triggers that affect her. Also, to focus on addiction and mental health is the goal to address with Gray both addiction and mental health symptoms effectively with the interventions. Treatment goals. The primary treatment goals for Gray include reducing depressive and anxious symptoms, eliminating Xanax misuse, and enhancing coping mechanisms. Emphasize on personal goals will cater to her unique challenges and promote meaningful changes in her life. Some primary treatment goals for Gray to point out are reducing the depressive and anxious symptoms, eliminating misuse of Xanax, and enhancing positive coping mechanisms when triggered by negative effects. The focus on personal goals is treatment will be tailored to Gray's unique challenges, emphasizing on promoting meaningful changes in her life. Treatment interventions and assessment CBT population and duration. Cognitive behavior, CBT, is particularly beneficial for individuals facing mood disorders and substance misuse issues. Typically, treatment spans 12 to 20 weeks, but can be adapted according to the client's progress and specific needs. Particularly beneficial for mood disorder and substance misuse issues. Sessions typically last 12 to 20 weeks, but can be rearranged on the client's progress and needs. CBT roles, benefits, and limitations. In CBT, the counselor acts as an educator and guide, while clients actively identify triggers and develop new coping strategies. The primary benefit is its structured evidence nature. However, it may not adequately address emotional barriers or client doubt. Some key points to point out are the role of the counselor and client in CBT. Counselors act as an educator and guide to the client so that they can effectively and actively identify their triggers and develop new coping strategies. The benefit of CBT is structured and evidence-based approach. The limitation of CBT may not fully address emotional barriers or any client issues feeling doubtful or untrustworthy. CBT duration. The benefits of cognitive behavior CBT, particularly effective for individuals with mood disorder and substance misuse. Duration CBT is typically 12 to 20 weeks, but based on grades, specific needs could be more. In role of participation from Gray. The role of counselor is to act as a lead and a guide towards effective therapy. MI, population and duration. Motivational interviewing. MI is ideal for clients experiencing doubt towards change, especially in substance misuse contexts. Sessions are typically short-term and ranging from 1 to 4 sessions, but can be integrated into longer treatment processes. Counselors in MI facilitate client self-exploration while clients take lead in identifying their goals. This method enhances natural motivation and respects autonomy, but may lack the structure needed for sustained behavior change without integration into broader treatment plans. Some key points for motivation interviewing is ideal for the clients with doubtful Doubting towards change, particularly in substance misuse, typically involves 1 to 4 short-term sessions, but can be longer if client is not fully participating. The benefits of MI enhance natural motivation towards a better life and also respects the client's autonomy. The limitations may lack structure and behavioral change without integration of more treatment plans. Ethical and cultural considerations for interventions. Both CBT and MI must be culturally sensitive, addressing Gray's unique experiences and preferences. Ethically practices include maintaining confidentiality concerning substance use and enduring interventions, are respectful of her cultural background. Some key points for ethical consideration and cultural considerations. Both CBT and MI must be culturally sensitive, addressing Gray's unique experiences and preferences. For the ethical practices, one must maintain confidentiality regarding substance use, ensure interventions are respectful of Gray's cultural background. Assessment tools. Effective assessment tools include the Yale Food Addiction Scale for Process Addictions and the Alcohol Use Identification Test Audit, AUDIT, for substance misuse. Both tools are reliable and validated, allowing for accessible assessments across diverse populations. Both CBT and MI have key points that are culturally sensitive, addressing Gray's unique experiences and preferences. The effective tools of Yale Food Addiction Scale for Process Addictions and Alcohol Use Disorder for substance misuse. The strengths of these tools are both reliable and valid and enable accessibility across diverse populations. Benefits and risks of each approach. CBT offers structure and research support, but may encounter client resistance to its format. In contrast, MI empowers clients, but may risk of uncertainty in unmotivated individuals, thus requiring integration with other therapeutic methods for long-term therapy efficiency. The key points of benefits and risks of each approach. For cognitive behavior, offers structure and research support. may encounter the client resistance to its format. For motivational interviewing, the client empowers by enhancing doubtful motivation. Empowers clients for natural motivation. The risk of doubtfulness is unmotivating for individuals and requires integration for other therapeutic methods for long-term efficiency. Relapse prevention model. Cognitive relapse prevention, CBRP, focuses on identifying stressors and developing coping strategies. It is essential for Gray to recognize her triggers and create alternate coping mechanisms to prevent Xanax misuse. A key point is for Gray to focus on identifying her stressors and developing positive coping strategies. The importance for Gray is to recognize her triggers, to essentially have alternate coping mechanisms to prevent Xanax misuse. Treatment planning. An effective treatment plan includes behavior activation and cognitive restructuring for depressive symptoms alongside MI techniques to address Xanax misuse. Ongoing assessments are crucial for modifying interventions based on client progress. Some key points for effective plan components are behavior activation and cognitive restructuring for depressive symptoms and the anxiety symptoms. Motivational interviewing techniques address the Xanax misuse. When looking for essential coping mechanisms, motivational interviewing could have techniques to address or prevent any alcohol or drug misuse. Conclusion and recommendations. Integrating CBT and MI tailors to treatment, fostering rapport, and addressing any resistance that Gray may have. Regular evaluations and adaptive strategies. Are paramount in ensuring positive treatment outcomes. Gray's misuse of Xanax is crucial for adapting strategies and ensuring a positive treatment outcome. Integrating of CBT and MI are both interventions that potentially are in the treatment plan that could help the depressive and anxious feeling of anxiety of Gray, and fosters rapport and addresses any resistance towards therapy. references.